Atopic dermatitis or eczema is an itchy disease that involves red patches that are incredibly itchy. Many times it keeps people at night and they cannot sleep, they itch all night long, and particularly when it's moderate to severe. When I say moderate to severe, it depends on how much of your body is involved with eczema. Of course, if you have 1 or 2 patches, then it will not likely interfere with your sleep. But if your body is covered with eczema, it's very likely that you'll not be able to sleep because you'll itch all these areas that are covered with eczema. Upadacitinib showed, I think, the best efficacy of any given systemic drug in atopic dermatitis. This study, first of all, it's the first study with a JAK inhibitor that shows a disease improvement that is over 50%. Phase 3 showed even better results than phase 2 with 50% and more clearance of the disease, or almost clearance of the disease. And again, this is an oral drug, and I think it's important that it's an oral drug because while we have a great biologic for atopic dermatitis, there are patients out there that simply would not want an injection and would necessitate an oral. And it's important for our patients to get options, and particularly such effective options that are able to control their itch rapidly and also to clear the disease in 4 weeks. Most of the patients were already controlled at the 4 weeks mark. This provides an opportunity not only for adults but also for adolescents with atopic dermatitis, because the study also involved adolescents, so it will provide a good option for not only our adults with atopic dermatitis but also for adolescents, because right now we have many adolescents that really need help. They need a systemic treatment but are afraid of needles, and they hear that they will need a medication that involves needles, and then they give up and they still have the disease. So it will allow us to reach a greater patient population, and it will clear them in 4 to 16 weeks, allowing them to lead normal lives. And this is what we need for our patients.